Welcome to the Edges of Lean. I'm Bella Engelbach, and in this podcast we explore the human and creative side of lean thinking, unusual places where lean thinking is practiced. We meet people who are practicing continuous improvement in many different flavors and styles. So come along with me on a journey to the edges of lean. Episode 70, Continuous Improvement and Empathy with Anjani Mahabashya. Anjani Mahabashya had a childhood dream to be a doctor. And she achieved her dream, and she got her dream job working in a premier medical center. Everything literally came crashing down the day she had a devastating fall. She's here to share what she learned about empathy and why empathetic leaders matter when employees are at their most vulnerable. This is a story all continuous improvement leaders who care about respect for people should hear. Anjani Mahabashya, welcome to the Edges of Lean.
Thank you so much, Bella, for having me on today.
Anjani, it's very nice to have you, and it's wonderful to have you here. You have such an interesting story. So could you please tell us what it is that you're doing today and a little bit about your pathway to doing that, because it's quite unusual.
Thank you, Bella, again. And to all our listeners today, I have 3 takeaway points that will come along my story. The first one is hope, even when everything seems to be falling apart in your life. The second one is networking. How do you build yourself back up? And the third one is empathy, to give something back to the community or others when your cup is full. I am currently a physician advisor at the Geisinger Medical Center, Danville, Pennsylvania. Prior to that, I was a hospitalist at Holy Spirit, another Geisinger facility in Harrisburg. Prior to that, a hospitalist in Iowa as well. And my current practice is as a physician advisor in Geisinger.
So what does a physician advisor do?
It's a newer development, been there about few years. So we are like a bridge between physicians, insurance companies, and the leadership. What my role, it's like a bridge. I literally have like a 360-degree vision of what is going on. So I do different things. The first thing I do is deal with insurance companies, because most of the insurance companies these days are tightening the screws. They're not really paying the hospitals. The amount of copay for our patients is increasing because they're saying that we're not going to pay for this particular procedure or this particular stay. So I'm actually fighting for our patients in the hospital and for the hospital to get that appropriate payment based on what's going on. Again, most of it is value-based care, where we are sticking within the limits of value-based care and also sticking with the rules of insurance companies. And my main work is also about Medicare. I also have to follow Medicare guidelines very precisely. And this is one part of it. The second part of it is educating physicians, because most of the physicians are taking care of patients. They really don't know what's going on with these insurance companies, the zillion rules that come up every single day that, okay, we're going to do this today, we're going to do that today. So I think my role again focuses on educating the providers. Again, I don't tell them everything because it's overwhelming. They don't have to know everything that I know. However, telling them the why, educating them why we do what we do and why is it important, what happens when that is not done, and how it affects both the hospital revenue and the patient satisfaction score. So that part of education is my focus. And the third thing is, again, looking through what is happening, where are we, where could we improve? How could we innovate? How could we do things differently? So in our meetings, we mainly focus on what is that we could do differently to make this process smoother, better, and innovate, whether it is in terms of educating our providers or having that dialogue with insurance companies. So it's kind of, I have a vision of everything. We're looking at the revenues. We know where the money is really going. So it's a bit of everything.
And there's a big continuous improvement piece of that, which is, I think, really important for for the patients, for the physicians, and I guess also for the insurance companies, right? I mean, because it seems to me that one of the big wastes that we see in healthcare is actually all of the time and the money and the people that are involved in solving these disagreements about payment and treatment and who gets to make those decisions. Wow. So when you started out, Anjani, and to become a physician, what was your vision of what you were going to do?
Thanks for that question, Bella. And to me, being a doctor is a childhood dream. It's because I lost my father very young, like I was only 12, and it was for a medical illness, and I really wanted only to be a doctor, and I didn't want anybody else to, go through that pain that I went to when I was very, very small. And it was just very young age that I decided I only wanted to be a doctor and nothing else, So I focused on that. I went to medical school in India, finished my med school there, came even during my med school to the US, did a lot of my rotations here in the US, went to residency in Michigan. Then I went to Iowa. I was in a particular visa called J1 visa, which required me to serve at an underserved place in the United States in order to stay back in the US rather than going back to my home country. So I picked that route, which is why I had to serve in Iowa during those 3 years. And then I moved to Harrisburg, Pennsylvania, and this time I was still continuing to be a hospitalist, which is we take care of those acute patients that are admitted in the hospital, and they're usually 12-hour shifts, 7 days straight. On your feet, you're literally running. You're just making sure that flow is going really fast in the hospital. People are coming in, out. Everything depends on the hospitalist. They're literally the trunk of the hospital, and that's what I was doing. And I unfortunately had a terrible fall and an injury on 26th of November 2019. That was actually just a week before I had the flight to Paris, and I love to travel. I've been to so many beautiful countries like Iceland, Switzerland, and I had a terrible fall, and that's it. One thing added to another. I was not getting better, and things didn't improve as fast as I wanted. Even if I was a doctor, my injury was no, I'm going to take my own sweet time to get better, and that's
so. Did you think that somehow that because you were a doctor that you would heal faster than other people? Was that something that you thought?
Oh, yeah.
Yeah.
Yeah, I was I will do physical therapy 4 times a week, get faster.
Yeah.
It doesn't work that way. And that was oh, wow. And so many times people also say, oh, you're a doctor, how are you sick? I'm oh, and that kind of, grounded me to I am a human too, it will take me time. So that was quite, I would say, humbling experience. And it was also oh, I don't get any concession, right? If I'm a doctor. And because I had injuries in my legs, I started gaining weight. I was very active, and then boom, from 100 miles per hour to literally being homebound for almost an year on the crutches. It was a terrible experience. You see how much I talk. So I had nobody.
Yeah. Well, and then we had the pandemic, right? So
the pandemic.
So yes, and then that made everything harder, I'm sure.
Very hard, no housekeeping help, nobody to help me with cooking. And just that silence that I experienced for being such an active person was so deafening to be in those 4 walls. And I started gaining weight. And one thing I would like to tell all the youth and women especially, I did something different here, Bella. When I gained weight, I just paused. I had to have that empathy for myself. I was dealing with so many things all by myself. So I paused. I got myself really, really beautiful clothes, actually really branded clothes, 2 sizes up, and I draped my body with dignity. I had to do that for myself, and I'm no, it's fine. Whatever I am, nobody takes away that I'm a human. Nobody takes away that, I'm a physician. Nobody takes away my knowledge, my humor, nothing, it's just a temporary thing at that point. And those few months, I'm not going to suffer. So once I did that, Bella, I loved myself. It didn't stop there, it really didn't stop there.
Okay, so let's rewind for just a minute. So you're stuck in the house, you're on crutches, the whole world is shut down. And like a lot of us, during that time, you gain weight. So instead of going into the closet and saying, oh, I feel so bad because I tried these things on and they don't fit me anymore, you simply said, let me give my body something that fits it. Yes. And that was, that is such an interesting thing to do, because that is not how we're supposed, right, Anjani? That's not how we're supposed to think about ourselves. We're supposed to think about ourselves as always striving for, some vision of perfection, right? And you're talking here about having empathy for Anjani and saying, hey, you're in this situation, you're stuck in the house, you're on crutches, we have a pandemic going on, why not at least enjoy what I'm wearing? So that was really a tremendous insight. Was there something in your past, in your history, that led you to having that insight, to not just diving into the guilt or the sort of the fat phobia about how your body had changed?
Very deep question. And I did, because when I was going through so many things, including, not being able to work, being stuck in the house, having this weight gain, no help, I only saw that 12-year-old child, who was really holding those ashes and saying, I just want to be a doctor. I want to be happy. And I'm like, no, I've already worked very hard in my life. And having that empathy for yourself helps having empathy for others. And I explained, Bella, when you said perfection is one of the things that blocks you from showing that empathy. So if you're not having the empathy for yourself, you want everything to be perfect, you're not able to have empathy for somebody who is not perfect. So I think it all begins with how you treat yourself. And I would like to add a couple more things that block empathy. One is perfection. You're not able to express empathy when you're blocking it with the idea of perfection. The second one is time constraints. You think that, I don't have time for somebody. And third one is, it is the fear, you don't want, what would you ask from me? Would you ask me my money? Would you ask me my time? How do I navigate the situation? And also a lot of people think, I really don't know what's happening with this person. How can I have empathy? How do we overcome that? By asking questions, hey, Bella, I don't know what you're going through. I have not experienced that. Can I please, sit with you and listen what you're feeling? So I think you're able to do that when you have empathy for yourself. You accept yourself as you are, and then you can accept the whole world. So that was it didn't come in a day. It took me a lot of going back and forth. But once I did that, Bella, that was off my table. Then I could focus on the other things, because things did not stop going downhill just with that. So I had a consequential injury in my good leg. Now I had injuries in both my legs because I was putting weight on the good leg.
Oh, no.
Yes. And then by then I had exhausted my FMLA and my disability, short-term disability, and I was let go from my job. And
wow.
It was just the down, one thing was adding to another, one thing was adding to another. And that week was the toughest week of everything, because that was the week when I was like, okay, I've worked all my life to be a doctor. And snip second, it was taken away, it was just that 10-minute call from the HR was, I couldn't even ask a question. I couldn't believe what I was hearing for the, I was like, did you say what you said, So
right. They just go through the script with you, right? That's
I don't remember what I heard.
You don't remember? Yeah. But they have a certain thing that they're going to say, and they say it, and then, yeah. And that is, can be absolutely devastating, right? Because Anjani is a doctor, right? That was what you set out to be since you were 12 years old. And now suddenly, well, they didn't take away from you being a doctor, they took away that job. But the job, we can get so ingrained that we and the job are the same thing, right? And we're not.
Yeah, it was my identity, right? Like I don't know anything else to do. So where do I go? What do I do now? It was just that kind of feeling that I felt helpless, so helpless. Like there was nothing I could do. And I had injuries, and I started looking for other kinds of jobs. Nobody would give me a job because I didn't have experience in the current role that I'm doing, which was mainly a desk job. There were other things that people were advising me in terms of going for a primary care physician or, doing a nighttime job, but everything required me to be on my feet, which was like a bad idea at that time. Like the injury was so bad. So that's when I actually saw a job posting open up in Danville, Geisinger, which was for the current role that I'm doing. And I took a chance, Bella, and here is like another point that I'm giving to all our listeners. You will hear no many times. I did hear no from other people. I still approached my medical director and I said, I have applied for this job, but I would like to talk to you. Would you please call me once, And I left him my number because he was a doctor within my system. He didn't know who I was. But he was so kind, and it was his empathy that allowed him to make that phone call to like figure out, who is this girl in Harrisburg who's asking me to call her? Let me talk to her. So I was fortunate enough to talk to him one-on-one. And I told him only one thing: I don't have an experience in this job, but if you give me this job, I will work very hard. And that's all. I didn't have to say anything else. He set up a formal meeting for me, and I did not take it lightly, Bella. I was studying for boards. Like for this particular role, you need a board exam. You don't need it, but then I was like, no, I don't want somebody to just give me the job. I want to deserve it. Like, I really want to do it well. So I studied for the boards. And by the time I got to the interview, I had all the theory knowledge. I knew what this job was about. I didn't do the job, but I had a theory idea of. So I smashed the interview. I knew that I did really well. And there were some issues going on with the legal side of it, where they could not take me from the hospital that I was working. I was technically still on the payroll because I was exchanging it with the PTO. So they had to iron out those things before they took me onto this role. However, I think it was my natural response to my boss's empathy, that I gave my blood, sweat, and tears to this role. And I did so well within no time, so well. And those little things that leadership does really matter, and they uplift the employees. And I would like to add a small example. For example, my office was on the first floor, Bella. It was close to an exit door. It was actually attached to a disabled parking. They thought through every single process of my transition. And I remember everything. I remember every single time that my boss or the rest of the team took care of my needs, whether it's like that 15 minutes early I had to leave, or 10 minutes late that I had to come if I had a physical therapy session going on. So those little things, when you treat it as a human being first, rather than, whatever your role is, you just feel so fulfilled. And I think I just excel for in no time. So I'm very happy that, the transition happened the way it was supposed to happen in the toughest moments of my life. Very, very tough moments.
So even in that really tough moment, something good was going to happen, and you taking a chance was part of that. But the other really big part of that story is the empathy that this medical director had for you. But I think it's also so interesting, Anjani, that this, these small accommodations, right, that made because of your physical situation, what a big difference they make, right? Yeah. And so that's something I think that we don't talk about a lot in continuous improvement. When we're working with people, when we talk about this concept of respect for people, somebody's ability to do something may be different from yours, right? They may have a different way of seeing things. Their mobility might be different. Their the stamina might be different, maybe different from other people on the team. And so I think what you're saying, so part of empathy is not just looking at that sort of from the legal Americans with disabilities perspective, but from the person perspective.
Yes.
But what could I do? What are the things that I could do? Like putting, making sure the office is on the first floor, or making sure that the signboard, the words on the signboard are big enough to see, those kinds of things, which actually probably help everybody else as well, can make a really big difference to engagement and retention. I mean, you're obviously extremely engaged now.
Yes.
Because of this.
Yes, it was his ability, Dr. Leshinsky, my boss, it was his ability to look beyond my resume, like I went back, after working very hard for 1 year, when we had this one-on-one, for the year evaluation, he said, you're doing so well, and I'm like, okay, why did you take me? Like you knew I didn't know anything.
Oh, now the truth comes out, right? Yeah.
I asked him that. And then, he said, your enthusiasm in your voice, I knew I could train you, but I saw that, and how many people look at these small things and not look at the resume. So I think that was fantastic, and that gave me that made me so much better as a person to see somebody beyond their resume, and we can actually get good people and teach them skills, but maybe training somebody to be a good person and have empathy, I don't know.
Well, it may be harder. I don't know about that, but certainly, one of the challenges I know that people face all the time in looking for jobs is that when you look at job requirements, that they are listed in terms of skills or degrees that people should have. Yes. And so first of all, it puts some people off, right? Because you could look at the list of skills and say, well, I don't, I haven't done that. I don't do that. I don't know how to do that. Or perhaps the degree may be somewhat different from the one that they're asking for. The problem, of course, is a lot of this is done by machines. So the machine just goes to the list and says, well, this person goes into the, their resume is going to go into the reject pile. So it's a really interesting question to me for in hiring that there are certain attitudes that you want for a healthy culture, for a continuous improvement environment. There are certain attitudes, ways of perceiving the world, ways of treating other people that we want to hire for. But you don't see that listed on a job description very often, right? So I would think for your role, Anjani, that empathy is actually a really big part of the role, right? Because you, as you said, you're kind of in the middle of, a patient, a healthcare provider, an insurance company, and, probably more than one, in some cases, more than one person in each of those places. They're all real people, all trying to do the job as they have been, told to do it, including the patient, whose job is to, try to get better or try to, stay as healthy as they possibly can under the circumstances.
Yes.
Everybody's needs are different, right? Everybody has different needs. So how does that sort of the empathy skill, that bone that you have for empathy, how does that work in this type of situation where you're dealing with not one, but two, with three competing sets of needs?
Great. First, I would like to add the, the resume and the skills part of it, because when I said the networking, the second part.
The networking,
the hope, and the second one is networking. Take that extra step, make those connections. I did not just apply to the job and leave it there, Bella. I reached out to the medical director within my system. I asked for interview. It might not always work out, you reach 10 people, maybe one or two would even respond. So I would say, and when you find that perfect fit, respect it and keep working hard. even today, Bella, I work as hard as the day I promised him that I would work hard. So I think that is it's a two-way street, whether it is love or whether it is your workplace. It's a two-way street. So that's where I will leave that. Now you asked a great question: how do I handle and how do I use this muscle of empathy for all
Yeah.
different roles? So here's the thing. So let's come to patients. I don't directly deal with patients, but I had a
Right.
scenario where one of the doctors had a patient who was very upset that she got a really big bill because she did not have the understanding of what exactly happened behind the scenes. Like, why did she get that bill? Rightly so, as per the insurance that she has and everything, she did not, she had to get that bill, and there's not much we could do about it. But it was, I really wanted to reach out on the behalf of her own physician, because sometimes when, like the physician and the patient, they might be at like a little bit of a rift, the patients might just be upset with that physician. So I had to step up, go beyond my role. It was not my role to like call that patient. I just had to do it to protect our physician. So because I didn't want them to like lose out on that physician patient relationship for a bill. It's a big amount, I'm not denying that, but more than that, like, I didn't want that bond to break. So I reached out to the patient, and once I explained it from an insurance perspective and what her doctor did and why that bill came through, she calmed down and she understood what it was. So I think it's always that gap in the knowledge, whether it is physicians or patients or insurance companies, that communication is something that is the next part of empathy. Like, what is blocking? We are not able to express empathy because we don't communicate properly. We don't tell them that, hey, I'm busy. I want to be there for you, but how about, I come after a certain time or a certain day. So the communication part is very important with empathy. With the providers, I was a provider not too long ago. So it was not really a big, I really didn't need a big empathy muscle there or like to imagine things. I was right there, like just not too long ago. So for me, just being mindful, like how is their day going? Like I know what happens on a particular day. So I don't bother them till 12 o'clock because I don't want to be scratched. So I'm like, okay, I'm not going to text you till 12 o'clock. You take care of your patients. And what I do is also translates into a lot of like, patient satisfaction and revenue. So I am very mindful of when I'm approaching them, how I'm approaching them. So again, empathy teaches you to be mindful. So that is the second component of how I take care of our physicians. And the other thing I also do is like, I pulled up all these presentations. I made all these presentations and I did something silly. I did something humorous where I had these presentations where, like there is a cartoon character of a surgeon doing the surgery and somebody gets a phone saying that, okay, Dr. Anjani is texting you now. So it's just for them to laugh that, yeah, I know I catch them at a wrong time, like I catch them in the middle of their surgeries, in the middle of their, hey, can you change this order? Because, this is the right thing to do for the insurance. It's annoying. I've been there.
Yeah.
Yeah, it's annoying. I know that. I know I'm annoying, and I get paid to be annoying. So how good is that? So I know that, but by adding humor, I'm acknowledging that, I'm annoying, and that builds a bond, and they laugh at it, and then they listen to me, like why am I doing that? Why am I bothering them? So that's how I was able to build connections in the first year of my role here, because it was very challenging, Bella. I came to a different hospital. Nobody knew my face. I came to triple the size of a hospital, with so many departments. Nobody knew what I was doing. Nobody knew why I was doing what I was doing. So it was very important to build connections, build those relationships. It takes a lot of front end work, but once you do it, it becomes smooth. So that's what I did with my physicians. Now, what I do with my the insurance companies, that's where respect comes, like you respect what the medical director of the insurance company is telling you. Yeah, you might sometimes, you look at a case from your perspective, they're looking at it from their perspective. That's where I would say not only with insurance companies, Bella, one has to know when to let go. You can't keep fighting something. So that's where I kind of, sometimes I lose, many times I win. And it's not about me losing or winning. We're both like, I bring them on board that we're both doing this for the patient. So so that's where it all comes down to. And sometimes I don't strain any relationship for, like a small thing. That I'm careful about those things. Like I approach on a different day, because once a broken relationship, it's very difficult to build it back. And so that's again, I want to talk about it. And in general, not only a workplace, even in your personal relationships, it's a marathon. There will be a lot of chances for you to patch up. Are you really being mindful about it? Are you really using those chances? Are you communicating? Like there are times the doctors are upset, that I leave them for that day, because I don't want to keep telling them, no, this is not the right thing to do. Because it's, again, X dollars versus 10X dollars. Like it's not just about that, it's about the relationship. Because I don't want to lose the physician. I don't want to lose my relationship with the physician. So I don't want to lose the relationship in my personal life. So it's like a marathon. So that's how I look at it, Bella. And leadership, I think, has been so far good. I learned from my leadership because from everybody above my boss up, I think they are there because of their empathy. And that's the common trait I saw in my boss and my boss's boss. And I just have a very small chain, short chain of command. And I see that if you want to go higher up, and this is another small little thing I want to tell for all our listeners. If you want to go higher up, every person I saw higher up had one common trait, that is empathy. So that's where I get my idea from.
That's beautiful, and that's also quite unusual, right? That's a very unusual trait to see in several levels of leadership.
It is.
So yeah,
it is. Yeah, beautiful. It is really beautiful.
Yeah. So you found a really good organization to work in where that's valued, and where people, it sounds like people are really seen as whole people, which is what we all want, right? We all want to be seen, and we all want to be respected. I think this role in and of itself, which is, I think, not a very necessarily a typical role, is an example of that, right? That there is this role, that this bridge between the healthcare providers and the insurance companies acknowledges the difficulty of that work. Yes. And the importance of it. And I know that one of the things that certainly I experienced in my life was that my primary care physician quit because he was tired of dealing with insurance. Mm-hmm. And he just felt that he was spending, he was spending more time in his day dealing with insurance than he was seeing patients. And that wasn't what he went into medicine for. And I thought that was such a terrible loss of talent to do that. So, yeah.
And that's why we created this role. And many organizations, big ones, have this role to offload that, stress of dealing with insurance companies from our physicians, and let them just take care of their patients. We have to streamline it that way. And it works very, very beautifully. And I was also very lucky, Bella, that I unexpectedly had an opportunity to work with senior citizens in our community. So not only I'm able to do all that I do at my work, I also had an opportunity to see what happens in our community. And I'll tell you a little story how this this
yeah, go ahead.
So again, it goes back to empathy. So one of my friends just called me and said, Anjani, my patient didn't show up on this Zoom meeting, the Zoom, online televisits. And I was just being a typical doctor. I'm like, yeah, how patients are, sometimes they don't show up, and I get this message on LinkedIn asking for a donation for one of these nonprofits in my community. And it was from another Geisinger doctor, another doctor from my own system. So I just thought, it's my own system, I will just donate something, but I just click on it to know what am I donating for. I go in there to see that they were senior citizens in our community who had no idea how to use a tablet, how to use an iPhone, how to do a televisit. And that was my aha moment. I'm like, oh my God, if they don't know how to do it, how are they going to show up for a televisit?
Exactly. Yeah.
and then like it didn't take me too long. It was just immediate response that, do I really give like maybe $50-$100 and wash off my hands, or do I go into the community to see what's happening? So I asked him, hey, Dr. Abdul, can I please come and volunteer? Like I want to just come. And he said, sure, come on in. And I literally just went that same weekend, Bella, and it was an eye opener. Beautiful seniors, and like extremely nice. And I was like so touched. I sat down with them, and they didn't even know how to take a phone call. They had an iPhone for like maybe 2 years, 3 years, and she kept canceling the phone. And just by 2 hours of me spending time and actually like even calling their grandchildren, talking to Susie's grandson, and she being excited about him going to college, or even this little things about them being able to connect with their families. Now they're so happy, they are able to like do all their televisits. It took us some time, but we got there. And some of the seniors were advanced enough, and they learned quickly. Now they're helping other senior citizens in their community, and we created that ripple effect. So that was just a beautiful experience. And Bella, what I got in Britain was, I just had a coughing spell, and 3 senior citizens ran in different directions to get water. And we miss out on these things. We always are saying, okay, this person doesn't love me, that person doesn't care for me. Go out into the world. There is so much more love. You might not find it the way you want it, but there's so many unconventional places, if you might call it, that there's so much love, there's so much care. And like I when I was a hospitalist rounding, there was no way I would see a senior citizen sleeping, and the TV is like at like it's so noisy. Would you sleep? Ask yourself, like put yourself in their shoes. How are you able to sleep? So I just go and turn off the TV first. If
Yeah,
I do that,
yeah,
I often turn off the TV, let them sleep. And if they're having this cold plate of food beside them, would you eat the cold food? I mean, come on. So first of all, for me, hospital food is like a big no. I don't think I ever ate it. So my hospital will probably like kill me for this. But having that little empathy, I just go to the nurse and tell her, hey, get a warm plate of food, ask the kitchen to like make it. Just those little things, get them help to eat. So sleeping, sleep and food are the healers, like, yeah, medicine heals, but this is your own body to heal yourself. So those little things are something that I'm asking everybody, just not physicians, to think of, what is the other person who like, can I do it? Can I sleep in that noisy room? So I want that empathy to be, like really like think about for another second. It's about belonging, Bella. It's about how good you feel when you do this. I had my neighbors, then no more, very nice couple, elderly couple. Whenever I park my car, like they're sitting in the balcony and we're chatting, and I think because because Mr. Smith is a little hard of hearing, I think the whole building knows my business now, because I'm trying
yeah.
where I went.
You're telling everything, huh, out loud.
Yeah, like so, but every time I parked my car, they were there in the balcony to greet me, like it's just coming home for somebody, it's not, you might think that's not my family, but start thinking they're your family, so, and those little things, I lost both of them this year, and when I park, it's an empty balcony. So, it's bad, but like that last year I enjoyed my conversations with them. They were so excited every time I traveled somewhere or whatever I did. Like I said, probably the whole building knows now, because I was like trying to tell them what I was doing. So that's where I'm coming from. Like life becomes very meaningful when you're actually mindful and you're present every minute of your life. Slow down, it's not a competition.
Yeah, and in continuous improvement, we talk about the concept of go and see. And go and see is, you don't just make suppositions about how things are working or why they're not working. You actually need to go and see and observe. And that's exactly what you did. But I love what you added onto that, Anjani. So you went to see what was happening with the senior citizens, and you learned about the problems that they were having with the technology. But what you found was something in addition, which was love. And so you found you took the step of going and seeing, and then you got this reward of seeing not only, that people can learn to use their iPhone, but also seeing how they're taking care of each other and how that community works. And, that's a wonderful benefit of going and seeing and, being in the neighborhood and talking to people and being engaged with the community. So thank you for sharing that. That's really terrific.
Thank you very much.
And one of the things that, that I think that a lot of people, hope for from the medical community, from healthcare providers, is more empathy. But we see people in healthcare being so rushed, yes. Right? There's you were talking about the pace when you were a hospitalist. I see the pace that physicians and nurses and respiratory and therapists, everybody else needs to work just to keep up. And particularly as staffing levels continue, I think, not to be where they could be. What's your answer to people who say, yeah, but we don't have time? I don't have time to pick up the remote and, turn the TV off. I don't have time to go down and talk to the nurses. I don't have time to ask, one more question of my patient during a visit because, some continuous improvement person has told me that I have, 17 minutes for this visit or whatever it is. What's your response to that?
Oh, I have been through all of that, Bella.
Have you? Yeah.
So yes. So here's the thing, human brain is all about risk versus benefit. We're always weighing what's going on. And that's where, you have to create abundance. I cannot create more than 24 hours time, but, using that effectively is something that, it comes down to empathy. How do you create that abundance? The thing that I do in the community is completely nonprofit. It's unrelated to my job. It's a nonprofit organization. How do I take time for all of these things and also progress in my own life? I still go on vacations. I do every single thing. Nothing in my life has changed. However, how are we using that time? What are we doing with the rest of the time? In your work time. So I think for me, I just feel like just rearranging things and seeing how it goes really helps. Again, having said that, Bella, I also know the other side of it. I would like every person to be considerate to all the healthcare providers. We are really, really pulled thin, and COVID has been really harsh. So again, like I said, every relationship is a two-way street, whether it is your personal life or professional life or your relationship with your doctor. So today, not only to the healthcare providers, but everybody who is watching today, please approach your providers with a little bit of more empathy, maybe, a genuine thank you, just telling that, hey doc, I know you're busy, when can you give me some time? And that actually, don't you think if you speak like that, the doctor would be like, oh my God, so we are always taught, how do we recognize a patient who is unhappy, angry, or, so on and so forth. We have to address that first. I have to go and say, hey, I know that you're angry, or I see that you're angry, and that calms the person down. You acknowledge the feeling first. So acknowledge, and it's again two ways, acknowledging that, hey doctor, I know you're busy. When can I have time from you? When can you talk to me? I would like to know about my mother. Is there a specific time? I will keep myself available. So I think, again, it's two-way street, Bella. We're trying really hard, and I know what it is, to be really rushed. So I think it's a two-way street. I would just request everybody, please. I've seen how our healthcare providers, like I said, I'm a human at the end of the day. My injuries take time as well. My healing, whether it is mental health or physical health, which a lot of us are battling during this COVID time, we feel the same pain. So please be kind.
I love that. Please be kind. Anjani, how can people find you? What's the best way to connect with you?
I am available on LinkedIn and only LinkedIn. So you can find my LinkedIn profile, and my messages are open to everybody. So if you want to know a little bit about our the role that I do, physician advisor, or you want to know more about how to study for that role, I'm very happy to help you. And that's all I have to say for today. And anything else, I'm happy to answer, Bella.
Well, thanks. So what is your one piece of advice for a young person starting out, Anjani?
For all the young people, I would say that, again, it's very difficult to see how magnificent and how huge life is from where you're standing, but it is really beautiful. And there will be a lot of ups and downs, and try to build an ecosystem. Try to build those authentic people in your life that will cheer for you, that will hold your back when you fall, and you live, you love, you fall down, you build yourself back again. This will happen in everybody's life, no matter what. So when you're building yourself back again, you should have already built that ecosystem of people, really authentic people who would help you get back on your feet again. So that's my advice to the youth. And I would say build that empathy, because empathy is like, there is a famous saying by Mahatma Gandhi, an eye for an eye makes the whole world blind. That's the context of, war. But if you don't have empathy, imagine if nobody has empathy, where are we heading towards? So build that, to your friend.
Build that. So hope, networking, and empathy.
Yes.
Those are your messages for us today.
Yes.
All right. Anjani Mahabashya, thank you so much for traveling with me to the edges of lean.
Thank you so much for having me, Bella.
This is Bella Engelbach, and I'd like to thank Anjani Mahabashya for being my guest on the edges of lean. How strong are your empathy muscles? Would you like to learn more? We would love to hear from you. Find Anjani on LinkedIn, find me on LinkedIn or at leanforhumans.com, or comment wherever you watch or listen. Subscribe and tell a friend about the edges of lean. Please join me in exploring more of the edges of lean. There's a lot to learn. And check out my friends in the Lean Communicators community at leancommunicators.com. You'll find more podcasts and videos with lots of great new content every week. The Edges of Lean is written and produced by Bella Engelbach with support from Podcast Inc. This is a Lean for Humans production.